John Schroeder is a physical therapist with DeGraff Therapy Services. John, thanks for joining us today on Medically Speaking.
Thank you.
First of all, if you can, talk us a little bit about what a physical therapist does overall, and then maybe how that is a little bit different in a hospital or outpatient setting.
Certainly. As a physical therapist, I treat people of all sorts of diagnoses. People traditionally know us as the orthopedic, sports medicine type people, but we do a lot more than that. So certainly in my practice here at DeGraff, we do the orthopedic stuff. People with low back pain, knee pain, people had their knee replaced, shoulder surgeries. But we also have occupational therapy and speech therapy here. So we actually do a lot more in the neurological diagnosis too. So people that had the strokes, brain injuries, concussions. I work with patients that have vestibular issues, people that are dizzy, off balance. Working in North Tonawanda, we tend to see a geriatric type patient, so there is a lot of balance issues. We work with them one-on-one to develop what they need to do to get back to their higher functioning level, regardless if it's pain, balance, weakness, those type of things, which is a little bit different than a therapist that would work in a hospital, which is trying to determine whether a patient can return to work or return home safely, when they can be discharged from the hospital, and if they need any other rehab before going home, whether it's stopping a subacute rehab facility or a long-term care facility or anything like that.
Sure. So you and your team's role, obviously, ensuring your patients get back to a better or their normal quality of life is very important. But quality of life, the last, say, 100 days or so, not only in Western New York or North Tonawanda, but across the state and nation's obviously changed because of COVID-19. Can you talk a little bit about how COVID-19 came through, say, the DeGraff location, and how that maybe changed how you initially were dealing with patients? We'll talk a little bit more long-term about telehealth, but just that first initial maybe 30 days or so, and how that made such a dramatic impact on you guys.
Yeah, it certainly hit us hard. We scrambled and tried to be as creative as we can to keep patients on board. We had multiple therapists go and join the command center in Buffalo General, which really helped us out numbers-wise. But yeah, right when it happened, we probably lost 75% of our caseload just in those first couple of weeks, just from the fear of it going out. We did a really good job, I think, of assuring patients that we're cleaning and things are safe, and we rearranged our clinic to get people spaced out as much as we possibly can, even wearing masks. Everybody's wearing masks, and we're cleaning everything. It's pretty sterile in our clinic now, and we started that right away. So I think once patients actually saw that, it alleviated a lot of their fear of coming out, and especially to our place, they became more comfortable. So.
Right. So you say, you and this is not unusual for any healthcare provider, to see only a 25% retention rate for patients early on, and not totally unusual, whether it was primary care or outpatient services or even places like the ED across West New York were being hit by this. How did you interface with that, say 25% of those patients who hung in there and still wanted to be treated? Did you guys move right to telehealth, or is it something that you started to see some patients in the office and a little bit of telehealth, or did you guys immediately make that switch?
No, telehealth and PT in the rehab world was a slow process to get through. Before this all happened, we weren't even allowed to do it. So this really came through all the actions through the federal and state executive orders that came out that started to allow PTs, OTs, and speech therapists to be able to start doing telehealth. So at the beginning, it was really trying to just retain and let the doctors know that we're still there and doing these things to refer patients that are really needed. But the idea was if we could get on telehealth, hoping that we could keep patients within our system, letting them know that we're still here, and hopefully furthering their functional levels and getting them, to the next level that we needed to be. This is going to be a thing that therapists will be able to do here on out.
But for physical therapists or even occupational therapists, it probably, I would think, presented a bit of a challenge for you, for someone who is so used to seeing patients in person. It's a very tangible part of the business in terms of seeing patients walk or move or stretch or do their dynamic exercises or the paces that you put them through. Is it challenging for you from a therapist perspective?
Again, I think with therapists, we tend to be a little bit creative when we look at people, or can look at ways to get people better. So the fact that through the telehealth that we're allowed to do, we have to be sitting and seeing them on video. We have to be that synchronous type of telehealth where we see them, we're interacting with them. So especially for a lot of the acute things, like if I get a patient that just hurt their back 5-7 days ago, some of that I don't even have to lay my hands on them. Part of it is just identifying a position that shuts their pain down and gets them comfortable, or with movements, we do repeated movements to see if we can shut down the pain, whatever's aggravating, if it's a little, whatever's aggravating the nerve, to see if we can get that to stop and get a patient comfortable. So really, even that first day in office, we would be doing that. So I can look at that, somebody moving through a video and saying, like, let's try this. What did that do to your pain? Did it change it? Did it make it worse? Did it make it better? And then we can problem solve and say, all right, this is what you need to do every few hours to get your pain under control. And then let them do it for a couple of days, follow up again with another telehealth call and see if their pain is more under control, and then progress them upwards like we would do here.
Sure. So do you see moving forward, just because of technology and what we've been through, do you see adaptation more to telehealth, number one? And number two, is that a good thing from the sense of knowing what generation is coming up behind the current demographic that you treat now? Is that a good thing? Because it seems like people are glued to their smartphone or their tablets. So has this been one of the benefits coming out of it, is the ability to mix telehealth in with regular in-person visits?
Yeah, you would hope that we would be allowed to do this longer term and turn it into a regular type tool that we have to use. So maybe starting somebody in the clinic live, seeing what they have to do, go through that evaluation, let them work on it for a week, follow up with telehealth so they don't actually have to come to a physical office and see what they're doing. And it might be more flexible for people's time schedule, those type of things, to not have to drive 15-20 minutes, do an hour of work, drive back home. We can just get online, see what they need to do for 30 minutes, get them moving in the right direction, keep them progressing, and then let them build up and through there.
Gotcha. So last question, the way that you talk about how telehealth is evolving makes me think a little bit about DeGraff itself. If you can sum it up as we close here, how DeGraff has evolved to continually meet the community's needs. Change is never easy, but it seems like DeGraff has always found a place to remain part of the community. And this is a good example of the outpatient business really evolving and in some cases growing to meet what that community needs. So tell us a little bit more about the DeGraff evolution.
Yeah, speaking for my department in the rehab world, we're pretty flexible. We always are trying to discover new ways to keep our practice growing and diversifying it. So there's always a place for us in the North Tonawanda world and the Clyda world, and making sure that we're doing the best for our patients. And, whether that's varying hours and changing what we need to do and educating us on the newer and better techniques that are coming out here, and some of the trendier, cheaper techniques that you've seen in the past, like cupping and taping. We do all that. So I think telehealth just goes to show you that, there's ways that healthcare in general can always be changed and progressed and probably be made more efficient. And it might be just one of those things that kind of help going forward to make sure that we're using our resources in a correct way. And I think that's just going to lead them for better outcomes, whether it's returning to work or just playing with grandkids. It's going to get those patients feeling better, moving better. And I think telehealth, again, if the general population in the community embraces it, I think it can really be a nice tool.
Well, with that, we'll wrap up. John, thanks for joining us today and sharing with us your story and DeGraff Therapy Services story about how you guys were able to evolve and adapt using telehealth as, we've come through this COVID-19, and how telehealth is going to be a big part of, I think, healthcare's future, especially in the outpatient world. So thanks for joining us today.
Thank you for the time.